Marilyn. Do we have any other department reports? Okay, great. We will move on to item number 4, which is the COVID-19 staff update.
And Dr. Richardson will not be joining us today.
Okay, well, go ahead when you're ready.
Okay, thank you. Well, there's always a lot going on with the COVID response. And I think the good news is that we are starting to see a decline in numbers. And yesterday we did add 15 cases from the weekend, which, is better than some past Mondays. We have last week, the state reported us at 46 point something per 100,000 daily case rate, which equates to around 10 or so cases a day. We are seeing a decline. We're anticipating the data today to be more in the 30s per 100,000, or closer to like eight cases a day. Now, again, that's a 7-day delay. So if we were to compare that to where we were in our reporting this last week, we anticipate our next dimensional decline. So the trajectory we're on is a positive trajectory, and we want to, we continue to be hopeful that's, we stay the course and continue to move towards meeting the metrics required for us to move through the tier system and move to that lower level tier in the future. We're not there yet, but we're trending the right way. Yesterday, we did, as of Friday, the state's contract with Verily shifted to OptumServe. And so this week is the first week of OptumServe, I think it's OptumServe, providing testing in our communities. The good news is they're offering additional days. So Bishop Fairgrounds is Mondays and Thursdays from 8 to 4. And Statham Hall and Lone Pine is Tuesdays and Fridays from 8 to 4. So that is increasing the access to testing. And it's important that we're utilizing that resource, that, employers in our South County can encourage their employees to access it, and we can encourage our employees in the Bishop and Big Pine areas to access the one in Bishop. It is always a challenge when you're bringing in something new, and yesterday was no exception. So yesterday was the first day in Bishop, and unforeseen circumstances. There was an unexpected staffing issue that they experienced that resulted in them having to cancel and reschedule those people who were having the schedule for testing yesterday. So, but we're up and running in Lone Pine today and hoping that those little kinks are getting worked out. And let's see. Oh, and we have heard some feedback that there's still some concern from our South County residents that some perception that the vaccine clinic that was held, the Mass Vax clinic in Bishop, was only for Bishop residents, and that was not the case. The Mass Vax is, and when we do mass vaccination clinics, we are going to be making that available to every resident in Inyo County. Using the system that we were using to schedule people, though, was challenging. It was our first time out, and we ended up having to use the Bishop zip code in order to make the appointments. So we hopefully will have those kinks worked out over time. And we're also hearing that some people in their you know, in our aging population who have registered on the county website have not been contacted and have expressed some concerns. So I do want to let people know that if you registered and you are, you know, 70 or older, your names are being taken, and they're being delved out to the various clinics from Southern Inyo to all the ones in Bishop. And what we have been hearing from our clinics is that sometimes the numbers they're calling are not good, that they were maybe entered incorrectly, or there's been some kind of an error, or they've left messages and not had return calls. So if you registered recently, you may just not have been called yet. But if you registered a while ago and you have not received that call and you're in your 80s, please go ahead and just re-register. It won't hurt that you're in there twice. It may be just that your phone number was not quite accurate. It never hurts to re-register, but by and far, we are hearing that there have been some challenges in getting a hold of people because of bad numbers and other, or leaving messages and not getting return calls. And then I'm hoping that Anna can talk a little bit about, a little bit more about the vaccines, what to expect with Johnson & Johnson, the third-party administrator, and some of the more detailed issues. So I'm going to turn it over to you, Anna.
Marilyn, can I ask Marilyn one question? Marilyn, on that, the phone calls, you know, I did get a phone call originally from something called Valley Health Care. Mm-hmm. And, yes. You know, they said I would get another call, and I did. And I registered for the vaccine. I got the first vaccine on the mass vaccine thing. But now Valley Health Care Center is calling me and saying that we just want to make sure that you get, that we've got the right information, and want to know whether you still intend to get a shot. When I called the number back on 2 occasions, there is nobody at that number. It simply says, there's nobody here, you'll have to call back again. So all I wanted to do was tell them that I actually did get registered, and I'm registered for the second one as well. But I don't want to take somebody's space up, you know, that needs that. But it doesn't seem like that number, that I can get through that number. So, and I don't know who they are, so.
Yeah, so if you have an opportunity to forward me that number, we can follow up with that. I know I called them this morning, and because I was helping someone get their appointment, and it was, I had called because they hadn't been contacted, and it was because the phone number was bad. So it was able to work it out, and I was able to get a hold of them. So if you could forward me that number, and I will follow up.
I will do that, Marilyn. Thank you.
Okay, thanks.
And I'll just jump in and add to that Valley Health Center is a federally qualified health center, FQHC, that's recently opened in the Bishop area. They do operate in other parts of California as well, but they've just opened up a new clinic here in Inyo County, and they also have registered to be vaccine providers. So in addition to both of our hospitals, Northern Inyo Hospital and Southern Inyo Hospital, and our Vaughn's Pharmacy, Valley Health team is also a provider. And so it is important, I think, for the public to know, because it's a newer clinic, that that is a place that we're also giving information to, so that they can contact and get vaccine out. So some residents may be receiving calls from Valley Health to schedule their appointment. So I appreciate you bringing that up. I'm not sure we've clarified that before.
Yeah, where are they located?
On West Line Street.
That's the new clinic that just opened.
Yes.
Okay. Thank you.
Yeah. All right. And just to add a little bit more around where we're at in our vaccine distribution within the county and statewide and federally. Big news this week is that the vaccine, the single dose vaccine that has been developed by Johnson & Johnson did receive their emergency authorization over the weekend, and we are awaiting word now about how that vaccine will be distributed. Did hear from the governor's office that we are expecting to receive some of this vaccine as soon as this week in California, but no certainty around how much will initially be available and how much will be available down at the county level in the next week or so. We do know that production is ramping up in the United States, and so we expect that more of that single dose vaccine will be available towards the end of March and going forward. Initially in these first couple of weeks, the availability is going to be a little bit limited, as we've seen as we've rolled out some of the other vaccines that have been approved. Takes a little while for the production and the supply to catch up. So we typically in California hear what our federal allocation is on Friday afternoons. So we're expecting to see that later today, hopefully, if not early tomorrow morning. And then once that allocation comes down to the state, our third-party administrator is now responsible for then making the allocations down to the county. So Blue Shield will get that information and then make allocations down to each county. So we sometimes get those allocations at the county level Tuesday evenings. Sometimes it's a little bit later, and we'll get them in Wednesday morning to be able to order by Thursday. So I'll know more hopefully tonight or tomorrow about whether we'll be expecting any Johnson & Johnson or I believe Janssen is what they're calling the vaccine now, whether we'll be getting that single dose vaccine immediately, or if in the next couple of weeks, those supplies will start to roll down to the county level. We did have a good phone call with our third-party administrator. We're in Inyo County in the second phase of rolling out, bringing that third-party administrator on as our method for distributing vaccine to our providers within the county. And so we're transitioning to that next week, but are starting those conversations. So far, had a really positive conversations with the administrator. They are aware that we did conduct a mass vaccination clinic that we do need to be able to get the second doses for in advance of our next clinic, for second dose clinic that's coming up on March 13th and 14th. So they're aware of that and are working to make sure that our allocation comes in for that, as well as that we continue to get our normal allocations to be able to push out through our ongoing clinics throughout the week. So we have been receiving reliably 500 doses per week. I don't expect that to change significantly for this week, but we'll certainly be able to give you more information next week as we see how those allocations are coming down from the federal government, especially with another vaccine available, and one that we expect will pretty significantly add to the availability of vaccine overall by the end of this month. We are also continuing statewide to focus on our 1B1 tier, which again is individuals over the age of 65, plus some of the some other sectors, including food and agricultural workers, school and childcare providers, and emergency services. So we're still rolling through those sectors, as well as continuing to make appointments for individuals over the age of 65. We are, as a state, moving into the next phase mid-March, March 15th, to be able to expand those who are eligible to include individuals between the age of 16 and 64 who have certain underlying health conditions. So locally, we're working with our vaccine providers to develop strategies for making sure that we can reach out to those individuals and give access to vaccine, and also what types of information we need to be getting out publicly to be able to establish eligibility under that tier. Once we get further into the end of March and into the early part of April, I expect we'll see then some additional transitions to continue to widen the eligible populations, and don't have any specifics yet on what the time frame will be and which populations that will include. But I do know at the state level that we're continuing to work towards broad distribution as quickly as possible. Along those lines, we are still working statewide to not only improve the use of the My Turn product that we did have the opportunity to use during the mass vaccination clinic in Inyo County. Other counties are continuing to pilot and work through the onboarding of that system. Ultimately, our goal is that we'll get to a place where there's no wrong door for vaccine once we're able to fully implement the statewide system and have enough vaccine available throughout each county that we'll be able to have one place that individuals can go to see where appointments are available and make appointments directly. So we'll be transitioning over the next several weeks from a more, I guess, tightly controlled, where we're looking at certain populations that are currently eligible and helping to get those people navigated to appointments, that it'll be eventually opening up much more widely for people to be able to, anyone who wants to have the vaccine, be able to make those appointments. So we're monitoring that transition, continuing to work and provide feedback around how the system has worked so far. The system is continuing to be built out so that it can be more responsive to the needs of both county providers and other healthcare providers that are administering vaccine in the state. So we'll continue to work on helping that system work as well as possible, not only statewide, but specifically for our residents of Inyo County. We are excited for this new single-dose vaccine to be available. We do expect that this is going to make it much easier all over the country to get more vaccine out. Obviously, it would eliminate the need to have the duplicate appointments and have the second dose, make sure that we're tracking people and getting them in for the second dose within a certain time frame. It is a refrigerated vaccine, which makes it easier across the board to manage and store and transport. It also, in the clinical trials, is indicating that we're seeing fewer reactions to the vaccine. So it's that also lends to our confidence in being able to get that out in areas where we don't have immediate access to a hospital in case there's a reaction. So we're encouraged by that. So we'll continue to watch. The state is continuing through their vaccine safety council, as well as at the federal and state level, looking at how best to target the use of this vaccine. So we'll continue to hear more over this week around what to expect as that vaccine rolls out. And I think those are my updates for today.
Anna and Marilyn, I'm a little bit disappointed that Dr. Richardson wasn't able to be at the meeting today, because one of the questions that I'm receiving from constituents is, which is the best vaccine, and should we wait for a vaccine? And I think, and I don't want to speak for Dr. Richardson, but that question came up at our last meeting, and his advice, I believe, and please correct me if I'm wrong, was that if you're interested in the vaccine, which I think people should be, then you should take the vaccine that is available at the time and not wait for something to come in, and so we'll end up putting that off and actually stopping or making it more difficult for some people to get the vaccines, for people that are on the list but are waiting for a particular named vaccine.
That is, I do believe that is what Dr. Richardson indicated last week, that I know there's a lot of focus on the effectiveness rate in general and the comparison, but you know, the CDC and what we're hearing and reading is that the Johnson vaccine has a high effectiveness rate. And its effectiveness around reducing hospitalizations and poor outcomes is very high. And Anna, we were talking about that a little bit this morning. If there's anything you want to add to that.
Yeah, you know, what we're seeing from this single dose vaccine is that it's about 85% effective in preventing the more critical form of the disease or severe illness. 100% effective at this point in what the clinical trials are indicating in preventing hospitalizations and death. So it's still a very, very effective vaccine. It is really important, especially as we see these different variants that are starting to circulate. We're in somewhat of a race in getting as much vaccine, as many people vaccinated as possible to get to that herd immunity, so we can start to address those not only the virus that we've been dealing with, but also the variants that tend to be more transmissible and spread faster throughout the community. We really, really do encourage people to get vaccinated as soon as they can, if they choose to, and that the vaccine that's available is at this point, we have 3 very effective vaccines. And so we don't want to encourage people to go after one or another unless there's some, you know, in some cases, it may be better for people that aren't as likely to get, I'm sorry. I'm going to stop there because I do not want to overstep into what Dr. Richardson should be saying as far as who should get what, but I do know in general that that individuals who are interested in getting the vaccine should take whatever vaccine they have available to them when it's their turn. And I'll end there before I overstep and start pretending that I'm a doctor, because I'm not.
Thank you.
Go ahead, Dan.
Yeah, I had 3 questions for you guys. The first one, in relationship to variances, when we get a new case, are we also testing to find out if there's one of the new variances that's showing up in Inyo County? Are we having a problem in the area of having people not accepting the vaccines? What kind of percentage are we having of people accepting or not accepting vaccines? And then the last one, in relationship to testing, I noticed on the website that it said you can get an appointment by going through this website, but appointments are not required. I'm assuming that you are strongly suggesting people get appointments.
Okay, I think I noted all of those. So let me start with the variant. So right now, in general, when individuals are tested for COVID, not every single sample is reflexed to the gene sequencing. So right now, I believe the number, and I'm sorry, this is off the top of my head, but I want to say around 1% of the tests are being reflexed. So enough of a sample within California to be able to identify the trends in the variant. But the state's really looking through their public health labs to really increase the amount of gene sequencing that's happening. So I know we're not at a place where we feel like we can improve in the amount of actual sequencing that's happening, so we can keep track of those variants. In Inyo County, as we particularly transition to this new testing model with OptumServe, we're switching the primary lab that's processing our specimens. So with the old sites with Verily, we were using a commercial lab, Quest Laboratories. Now we'll be using the new public health lab in Valencia, and so a larger proportion of our specimens collected locally will end up in that pool of specimens that get sequenced. We have not identified at this point any variants that we've been made aware of in Inyo County. But also we're trying to ramp up as a state the surveillance around that. So there is a variant dashboard that the state has stood up where they are reporting out when they're identifying and what types of strains are being identified. But at this point, we haven't identified any specifically out of Inyo County residents. And that's partially because there's not a lot of the sequencing happening potentially. That doesn't necessarily mean that we're not seeing variants locally. So we do want to remain vigilant and make sure that we're continuing to practice all of our preventative measures in the hopes that we don't end up seeing another significant increase either locally or statewide or nationwide with these faster spreading variants of the disease. Acceptance rate, I would say that we have been very successful in as we are offering up vaccine to different populations. A lot of people are interested, and we're filling up appointments. We're starting especially after the mass vaccination clinic and trying to keep up with the number of people registering. We were seeing a little bit of a slowdown in that as we get information out to the different clinics and they're calling, there were a pretty large number of people that have already accessed the vaccine, or, so we were having a little bit of trouble filling some of the appointments last week. So we've kind of I'm sorry. I got so excited with my hands, I pressed a button and lost my video, sorry. So we have been working to continually clean up the list, and that's one reason too that, and as Marilyn already said, we want to make sure that if anyone has been added to the list and hasn't been called yet, especially if you're over age 75, or we're still working through our 65 and over, but we should be fairly well through the oldest of our population. So if there's anyone out there who hasn't received a call, we want to make sure that they're re-registering so that we can continually clean up and refine that list. So I do still think there's a lot of demand within the tier that we're in. We are looking forward to continuing to expand those tiers and be able to fill those appointments. So I don't have an absolute number of everybody offered, how many have accepted the vaccine. I know within our hospital systems where we had a little bit more of a controlled study, we had much better in general acceptance rates than we were initially seeing throughout the state amongst the healthcare population. And I don't have those numbers off the top of my head, but we had impressive number of people who were accepting that in the healthcare realm. For testing appointments under this new OptumServe site, they do have the capability of accepting walk-ins. Certainly, it's nice to have people register in advance if they have access to the computer and are able to do so. That helps the team plan. But right now, we have the capacity to do upwards of 150 tests per day. So I really feel at this point, and especially even though we've had a fairly good, consistent rate of individuals who've wanted to be tested, we've not been anywhere near that number. So from a capacity perspective, I think people can feel free to show up and register on site if they otherwise can't register in advance. We do have a translator on site to be able to assist with Spanish language translation to be able to get people registered, and the capacity from a staffing perspective to be able to register on site too. So I do hope that helps expand the access to testing for people that want it, and it makes it a little bit more streamlined for registering if individuals don't have the capability of doing that in advance on their computer.
Thank you.
So I did not have my meeting with the CSEC rural group last week, but we did have an executive board meeting with Dr. Gali and Secretary Manasantos. So it appears like they'll be making some adjustments to the blueprint. They were skimpy on the details of what that's going to be, but it sounds like they're going to take vaccines into account statewide and maybe raise the threshold or lower the threshold, however you want to put it, make it easier to go from purple to red. And the other thing of note that they talked about was that they expect within a month or two that the demand for the vaccines will flip, that it will go from having more people who want it than there are doses to more doses than people who want it. So I think that's when, Dan, the answer to your question of the adoption rates will come about, is when we hit that point. But in a way, that's encouraging news that within a couple of months, pretty much anybody who wants to get it will be able to get it. It will definitely loosen up at that point. Do we know the number of vaccines that we've given out in Inyo County to date?
Well, there is the $64,000 question. On the state's website, I think right now they're showing us as having provided 5,775 doses. Now, those are not unique individual doses. So those are not the number of people, but the number of doses. So it does include some second dose numbers. What it doesn't necessarily reflect is our tribal community, that any doses given out by Toyabe. And we are still having some challenges in capturing the Vaughn's, local Vaughn's numbers, because Vaughn's is a chain, and so it's been a challenge, and we've been working with the state on that. But I believe, Anna, that our understanding was that Vaughn's has distributed about 907 so far, and Toyabe by the end of today will be at 980 first doses, I think. So, unfortunately, it's difficult with the state's data dashboard. It's not tracking unique individuals, but number of doses. So teasing out how many of those are unique is a little bit more of a challenge, but we are making forward progress. Anna, did you want to add anything?
Yeah, I'll just add. So what the state dashboard's showing right now is about 5,700 total doses for Inyo County residents. They also look at it a little bit differently than we would, in that they're counting by location of residence, not by how many administered in Inyo County. So there's a little bit of a difference there. So for example, some of our residents that live in Inyo County but work out of county may have received their vaccine out of county by virtue of their employment and are counted for Inyo County, and vice versa, where we have people that live here but live outside of the county but receive their vaccine here wouldn't be counted. So there's always going to be a little bit of a discrepancy where we're looking at how many we've administered versus what's showing on that site. But it's getting more and more accurate. We are continuing to work with Accenture, which is the data team that is working on tracking vaccine in California, and continuing to advocate, particularly to the extent that vaccine distribution rates get accounted for in any kind of tier designations or any other kind of measures that impact our counties, that we are continuing to advocate for making sure that everything that's administered in the county gets counted in those numbers. And so, as Marilyn said, with Vaughn's in particular, because they have the capacity and have staffed up to be able to administer quite a few vaccines, they're getting about 40% of our allocation on a weekly basis to distribute. So that's pretty significant. And I think that's more significant for us than probably a lot of other counties that Albertson's corporation is operating in. So we're continuing to press that and make sure that before any kind of decisions get made, especially if it ends up being pulled into tiers, that we're getting as much of our vaccine that's actually administered here counted as possible. So we're continuing those conversations and advocacy.
The state folks did make it pretty clear that any way that vaccines are taken into account for tier adjustment would be on a statewide level. Understanding that there are data issues and there could be perceived and real equity issues with doing it county by county.
Jeff, I have a question, maybe it's for you, with regard to the state rural caucuses. And one of the local physicians that I spoke with indicated that he has traveled because of business, but he's traveled in certain other states. I know there's been a lot of questions about restaurants, and his indication was that in certain states, they've actually opened restaurants up based on the fact that if you have a certificate that you've been vaccinated, then that restaurant is actually open for people that have been vaccinated. Has that issue been raised at all? Have you heard anything about that in California?
I've heard nothing about a vaccine passport kind of thing that you're talking about. There is, particularly amongst the rural caucus, but for all of the counties, a large push to get at least some indoor dining in.
Right.
And it sounds like the state doesn't want to change the blueprint of what's in purple and what's in red, but to make it easier to go from purple to red in order to get to that. But as far as a vaccine passport, I've heard nothing like that.
Okay.
I've got a couple of questions. Unless Jen wants to go, I don't want to. Okay. Do we have any idea of how many? I'll ask Amal. And do we have any idea of how many people are still left in the 65 plus tier? Because I was actually surprised when I was hearing of people in the 80s saying that they had registered and hadn't been called. That surprised me a little bit. Does the third party distributor, do they make the decision on what kinds of vaccines go where? Or does the state give it to them and then they have to do it evenly? I mean, in other words, the J&J vaccine is easier to, as I understand it, transport and thinking about people living in the most rural areas, that certainly would be might save a lot. It might save travel, might save, you could put the effort into having, you can't move a hospital to those places, but maybe if you're only having to go there once, you could go there and set up enough of a medical facility to distribute that. The bonds number at 40% of our vaccine, being in South County, that isn't exactly great. It doesn't seem like. I mean, depending on how the rest is being distributed, but that does leave people needing, if they do get called, having to travel again at least an hour to get it. And then it is really great news about that you could actually walk into the new testing facility and be helped there to register. That I was just trying to do it as we were talking, and it's pretty good, although I don't know, it's really wanting a lot of information about insurance, and some of the stuff isn't even on my insurance card that they want to know. So that seems a little bit rough. And then on restaurants, to Rick's question or point, I mean, I think it's possible that California may be the only state left not allowing indoor dining in parts of it. Maybe not, but it it's possible. And it is really, that's my biggest problem right now is the restaurants that, have been doing it and then are getting in trouble, and the reporting of each other. And it's horrible because it's pitting restaurants against the county, restaurants against each other. And I know this is, I'm just preaching now, and I know there's nobody on this call that can do anything about it. But to me, it is the biggest problem, particularly thinking about other counties that are just not enforcing it. And it seems, I've been to Ridgecrest now and seen, national chains allowing indoor dining. So it seems obvious that some counties are just, I don't know exactly how they're doing it. But at any rate, those are my comments and questions. And I might have follow-ups, but I can re-ask those since I preached so long if I need to.
I think one of your first questions is you wanted to know how many people 65 and older. I don't know that we have a good way of confirming of the doses that we've given, how many are 65 and older. I will say that we have approximately 2,000 residents who are 75 and older, and another probably over 2,000 that are in that 65 to 75 age group. We have, in going through the registration list, we started with our very oldest. We have people in their hundreds, and started going down. We've been sending people who are in their 65 or older group out. Their names have been going out to get appointments. So if you're hearing someone who is 65 or older who has not been vaccinated, I would encourage them or someone that they know to help them, or if they need help registering, to call, and we will call the vaccine line, leave their name and phone number. Somebody will help them get registered. We are absolutely registering and helping people get vaccinated. So if they were 80 and they were on the list to get a call and they didn't get a call, it may be that their number was incorrect. It may be that there were messages left. I don't know. I know that it's hard to speak to what is anecdotal, but I will say, if somebody does not know how to register online, or they're concerned and they want to make sure their name and is in that queue to get a vaccine, they can call 760-873-3232. That's the vaccine hotline number. And if they leave their name and phone number, somebody will call them back and make sure that we have them in queue to get a vaccine.
Thanks.
Now, I did sort of, I'm not quite sure what the next question was, though.
Well, I just wanted to comment on that. Thank you. I will follow up on those. And I don't think there's any, who knows? I mean, in the case of the ones I was talking to, they thought they had registered and that they were in the system, but I will follow up on that to double check. And then the next was just about the third party. Do they get to pick which kinds of vaccines go to which counties, or how is that distribution done?
So the distribution to each county, the most direct answer is yes. That is the role of the third party administrator, is that they will be managing the allocations down to each county. Right now, the allocations are based on what sector is currently is currently being served throughout the state. And so they're taking numbers for each county, population estimates that fall into those different categories, and distributing vaccine according to those population estimates. So it's a standardized way of distributing the vaccine down to the counties that so far has adjusted. You know, it's been adjusted over time as we moved out of the focusing on the healthcare population, the 1A population. Actually, that's one reason we started to receive see increases in our allocations, is because then as we incorporated in the current age-based criteria, as well as the other sectors that are being targeted currently, that increased the proportion in Inyo County that Inyo County received. So they're continuing to use allocation methodologies that are consistent across the counties. Those will continue to shift, I think, over time as we change which populations are being considered, or whose turn it is in the vaccine line, so that can change our allocation over time. How that gets applied to Johnson & Johnson, I don't know yet, especially as the amount is limited. I know at the state level, they are still looking at how best to target the use of the vaccine. So it could, I have not heard this, but as you suggested, if it's a vaccine that's easier to get out to very rural areas for various reasons, or if it is more effective with certain populations, for example, there may be some recommendations that end up impacting how that vaccine gets allocated. And we just don't know that yet, but should know more through this week and into next week. I do want to add to, I'm sorry, to go back to the question about access to vaccine for individuals who are over the age of 65. I do want to also add that in conversations with Southern Inyo Hospital, they are taking appointments directly as well. So if we have individuals in the southern part of the county that have not been able to get an appointment, they certainly can also reach out to Southern Inyo Hospital's clinic to make an appointment as well. And we are continuing to make sure that enough vaccine gets down to Southern Inyo Hospital as well, to make sure that they have, to the extent that they have the capacity for appointments, they have enough vaccine available.
Yeah, that's what I have been advising people to do, is call the clinic directly. And I think in some cases that's what they had done, but I'll follow up on that. I'll double check that. My big hope was that, and still is that the mass vaccine clinic drew enough people, even if people from Southern Inyo couldn't go, or didn't get registered, it took enough people off of the list to make make it more available to the other people here, and that would help that. But this week, I don't know why, I just seemed like I had a couple of people saying different, in other words, that they were having some trouble. And then the 40% of the vaccine going to bonds, is that, again, the third party that decides that? Or, and I get it that's kind of a good thing, because it means you guys, it just gets done by somebody else, and isn't as much impact on our staff. But is that the third party picks?
Yeah, eventually it will be. We haven't completely transitioned over to the third party distributing. Currently, of our allocation, we're working with our distribution partners to see how many vaccine appointments they have available, and then distribute vaccine accordingly. So that's not an overall how much total has gone to Vaughn's. That's just a recent example of how that broke down, and why we're very much concerned about the data. That's not a fixed number by any means. That's just a reflection of how many appointments were available over the last couple of weeks, and making sure that we get the vaccine to the places that will use it within that week's time.
Sure. And Vaughn's, people do not make appointments directly with Vaughn's, or do they?
Yes. So we're taking our list of people who've registered through the county registration site, sending their contact information, and then Bonds is sending out a link to register for the appointment. So they're making appointments directly based off of that list.
Okay, but if you're not, in other words, you can't just call up Bonds if you're not on the registration and say, hey, I want to get it, or can people do that?
It's
Not at this time.
Okay, that's fine. I just want to make sure I can answer questions that may get asked.
Yeah, we do not want to encourage people to call Bonds directly because they are really filling the slots that we're sending forward the registration list to help manage that and streamline that.
Yeah. But they aren't necessarily just filling taking names that are just from North County. They're just taking names.
Right.
And Matt, on my call with the state, the public health people are, as Anna said, figuring out the best way to distribute the Johnson & Johnson one, because they recognize that with just one dose and the refrigerator that it's beneficial for quite a few populations, rural areas, remote areas, people who move around a lot, like farm workers and, maybe homeless people, and trying to figure out how to message that, because there is this perception that it's not as effective. And so people are like, well, why are they giving this one to us? So they're working on figuring that out.
Yeah, I get both sides of that too. Sure. Okay, great. Yeah, I hadn't thought about how many other populations that it might really be well suited for. Also, thanks for mentioning those.
Okay, Supervisor Rozier, do you have anything before? There's a couple of hands raised. I want to give you a chance before we take comment from the public.
I want the public to have a chance to speak out on this. I guess I did have one question about the Vaughn's vaccination clinics. Do they have an EMT, given the need for emergency medical staff when you administer the vaccine? Do they have someone on site that does that?
They have pharmacists that are administering the vaccine and monitoring individuals. So no ambulance, I think, stationed on site, but are close to a hospital and would call for emergency response if needed.
Yeah, and then just my other comment, really more than anything, similar to what Supervisor Kingsley said. I understand, and it's been explained to me that it's somewhat reckless, but reaching out to businesses, friends that I have in San Bernardino County, in Riverside County, Kern County, as well as a supervisor in 2 of those counties, with regards to restaurants. It's a policy reminiscent of a military policy in the 1990s, and I don't understand why we can't propose, or not. I know why we can't propose that, but I just think it needs to be more carefully considered. I've been reading emails this morning, and I cannot understand why we're still here in this position with businesses suffering. So I guess I'll just say that again. There's no point in belaboring it here, but it's just troubling, and I'll leave it at that. Thank you.
Okay, we have a couple of hand raised. Galaxy Note 8, you could promote, and if you could tell us who you are and give us your comment, please.
Hey, this is Holly Molinex from the Bishop Twin Theater.
We can hear you. Go ahead, please.
Oh, okay. Well, obviously I agree with all the frustration that some of you have relayed on the restaurants still not allowing inside dining and things like that, and how it's kind of, a couple have shared that your hands are tied and there's nothing you can do. I guess, not that I want this to happen, but I think the thing that's been challenging for us, besides the fact of being closed, is that it feels like even in Inyo County, it's being picked and choosed on what you guys enforce. It's not that I want this to happen, but I've called and emailed 4 different times to 4 different people about the fact that there is no monitoring of the amount of people that go to Vaughn's or High Country Lumber. And I'm not singling them out, but if they have a requirement of 25% capacity or 50% capacity, and they're not having a door monitor to confirm that, then it seems like when you don't allow restaurants to eat inside, or the movie theater to open, or the bowling alley to open, that you're deciding what's your priority in enforcing this purple tier. And I don't understand it. So I guess that's really my comment. I feel as if the easy, smaller businesses are easier to control and to mandate for you guys. And the bigger ones, well, it's okay if Smart and Final has 53% occupancy because they're Smart and Final. But it's really easy just to say the bowling alley can't open, the theater can't open, restaurants can only eat outside or do to go. So there's my input, frustration going on basically a year of, okay, all right. That's all I have to say. Thank you.
Okay, thank you, Holly. I appreciate it. I know that Leslie's not here with the businesses, but is there someone else that has any response to what Holly said?
Sure, I'll respond. I mean, I think that's a reasonable comment, and we'll take a look at that. And that hasn't necessarily been where resources have been put to. So, but it's certainly something we can look at, and I think it's a fair comment.
Okay.
Can I just mention to Holly, there is nothing easy about telling a small business that, you know, that they can't operate. I mean, so just understand that. Maybe I get what she's saying, but man, I'll tell you, I am spending time talking with small business owners only. We don't have any national, well, we have some national chain restaurants, but that's not a problem down here in Lone Pine. So just so you understand, nothing easy about the situation that we're in and dealing with small businesses at all.
Okay, thanks. We also have a hand raised from Dave Blacker.
Good morning, everyone, and greetings from I guess we would call it a frustrated East County. I'm going to try to use the same wording and stuff that you guys use in your updates, COVID updates. Which, by the way, I think you guys are doing a great job on the COVID updates. I have nothing but good things to say about Darcy getting these done, and love having the information. I was hoping to ask some more data related questions, but obviously we don't have data. So, or if we do have it, we don't know how to put it all together. So instead of asking those questions, I'm interested in exactly how many severe reactions to the vaccines we've had in Inyo County. Can somebody give me a percentage or a number or anything along those lines?
Anna, Marilyn.
Yeah, there hasn't been a high percentage. It has been a small percentage. I don't have an exact number for you, but there have been situations that have required emergency room response and breathing treatments, and but to be able to give you an exact percentage, it's a small handful, and but it is of a nature that is concerning for the the general health and well-being of those experiencing the reaction.
Okay. The other thing, just to make a comment on the Eastern County folks that were feeling a little left out of the mass vaccination clinic, I'm not sure the issue is as much the difficulty of signing up for an appointment as the fact that it's a 4-hour drive. I live here in Death Valley. I am more than willing to drive 2 hours to get a vaccine in Lone Pine. I would do that. If they called me right now, I would drop this call and go do it. And I'll take any vaccine that's available. But if you're on a fixed income and you're in your upper 70s, early 80s, and you're living in Tacoma, you may not have the ability to go all the way to Bishop to get a vaccine, even if you could make an appointment. Eventually, and I know you guys are probably waiting for the J&J because that's the easiest way to do it. Eventually, you're gonna have to leave Bishop and Owens Valley and come to Shoshone and Tacoma, and that's gonna be the only way to get to those folks. Some of those folks are trying to work the system and figure out a way to get the shot in Pahrump, but Nevada is doing as equally a great job as the state of California is at getting out vaccines, and they're getting fewer of them than California is. So if you're living in the middle of nowhere, this is really not a great time to, be counting on them to be the ones to be proactive and get this done. So I hope you'll keep that in the back of your minds. I will continue to work with Matt Kingsley to figure out a way to make it available for you guys to come down here and do this. Death Valley National Park handles emergency medical cases, unfortunately, way more often than we would like to. And, if we can figure out a way to safeguard and have the ability to react to severe reactions, then we would certainly be able to put those in place. All in all, we're right in the middle of our busiest season. This is March 2nd. March is our busiest month of the entire year. If we don't make money this month, then there's a possibility of laying people off this summer. So something has to change fast in Death Valley in order for us to be able to make it through the summer without having to reduce workers, reduce hours, and adversely affecting our tourism industry, which is the single biggest employer in Inyo County and the single biggest generator of tax dollars when it comes to TOT. So we're doing more than worrying about people's health here. There's also worrying about their futures, and nobody's going to get out of this unscathed. So the sooner we can get some help, the better. I hope one day that we will all have you all down here on a nice sunny 78-degree day, and we'll be able to shake hands and stand within 6 feet of each other and drink a glass of scotch and say to hell with this stuff. So I look forward to any questions you guys have about Death Valley stuff or about stuff that we can help arrange out here. And other than that, I wish you all the best of luck. Stay safe and take care.
Thanks for being on the call, Dave, coming on the meeting. Dave's been coming on regularly, and I really appreciate it because it helps distribute information to South County, having people on watching and then able to talk about the updates. So thanks.
Thanks, Dave.
Well,
Appreciate it.
We're not South County.
Sorry,
We're East County now.
Okay, thanks, Dave. The next hand raised is Lynn Greer.
Hello, am I unmuted?
Go ahead, Lynn.
Okay. Hi, good morning. I'm here to kind of back up Holly a little bit. You know, I know you guys have about heard it all, and everybody's kind of sick of this whole mess. But, you know, to sit down on Main Street on a Sunday and watch the gas stations be packed full of people traveling home from enjoying a great weekend up here, and watching tons and tons and tons and tons of to-go food in styrofoam, which is, if there's anything I'm against, it's styrofoam for the environment. It just, at this point, it's just beyond ridiculous. And I understand very well that I am not privy to your information that you guys get in front of you, and that I'm seeing this from my fellow community members who are pretty much feeling like Holly, they could barely speak. And so once again, I would just like to ask you, as a community member, what can we do? Can we write letters to the governor? I mean, to sit there and say until we get down that percent of 100,000 people, whatever math that is, it's just crazy because we're so far from even 100,000 people in our population. So I think it's a lot easier for a lot of people. You can just see them going on about their business, getting on with their days, ordering the food that they need. But there's a year later, you know, I don't even want to talk about the kids. That's another whole issue that makes me sick. So, you know, I don't know what else there is to say. I just want to know that nothing has changed for me. I'm begging for any of you to give me any ideas of who we can write to, how we can change this thing. You know, to have these mom and pop small businesses basically being punished while there's just commerce going on around everybody. You know, I mean, it's just a tough pill to swallow. So I know you all have hearts. I know it's not been easy on you either. This hasn't been easy for anybody, but you know, I've said it 1,000 times, the first person to give up that nourishing meal and the roof over their head, please raise your hand. You know, there's people in the initial beginning that wanted everybody to stay home. They did not give up an income. So, and like Dave said from Death Valley, you know, we're also worried about our employees. We take care of families. So I don't need to go on and on, but if there's anybody I can write to or help anywhere, nothing has changed for me.
Okay, thank you, Lynn. We have one more hand raised, and that's Tiffany Lau.
Yes, first of all, I'm really happy to hear that there's a translator available at the clinics, is it, or the testing sites? And I was just wondering how it was coming along on outreach to the Spanish speaking community, as far as like news on mass clinics and such.
Anna, Marilyn?
We have been working with the state to ensure that we're getting our second dose vaccine coming in, and we'll be getting information out over these next couple of weeks as widely as possible to all of our communities in English and Spanish to be able to advertise that. Also, as we transition to getting information out about any changes in the testing schedule, did want to make sure that we got off to the right start in our clinics this week, and we'll be doing some additional outreach around getting information out for testing services as well. So we'll continue to be reaching out in whatever methods we can to get that that information out to the community.
We also publish in El Sol and do get our press releases translated, trying to get as much information out as possible.
Thank you.
Okay, thank you. And with that, we do have an 11 o'clock timed item, and we're about 20 minutes past that. So thank you again, everyone from the COVID team. And that will conclude our COVID-19 update. Do we know, is Leslie Yen or the Forest Service team available in the attendees?
They are.
Okay,